innovadora y recientemente Brennan es el creador del servicio de realidad extendida médica, en donde se utilizan los servicios de realidad virtual e inteligencia artificial en beneficio de pacientes con trastornos funcionales digestivos. He de decir que Brennan habla muy bien el español y que nunca quiere dar una plática en español, pero ahora lo irán en inglés. Entonces, estaremos atentos a tu plática, Brennan.
Muchísimas gracias por la introducción y como puedes oír, yo puedo hablar un poquito español. Yo vivo en Los Ángeles y más de 50% de mis pacientes solamente hablan español, pues por eso es muy importante hablar español, pero es muy difícil por mí hablar en español en temas técnicos, por eso voy a cambiar mi idioma, pero es un honor estar aquí con ustedes en esta conferencia magnífica. So thank you again very much for that. So I am going to talk about a rather different topic than what we've just been hearing about, although it's still on the same topic in general, of managing our patients with functional GI disorders, with disorders of gut-brain interaction. But I'm going to be talking about something a little bit different, the role of virtual reality, Realidad virtual. Now, this is a picture that is from Dr. Emran Mayer, describing what we understand is happening with disorders of gut-brain interaction. This is a complicated figure. We could spend 2 days talking about it, but we know that the brain and the gut are connected. We also know from work by Dr. Ford and others that behavioral and psychological interventions like cognitive behavioral therapy are very effective for managing the symptoms of many functional gastrointestinal disorders. Now, this is a technology. I'm curious, who has used this before? Okay. So, en la otra sala, solamente cinco personas raised their hands, pero hay más aquí. So, normally, people think of this for games, for entertainment. They think about children playing games with virtual reality. But what I'm going to talk about today is how can we use this technology for our patients with disorders of gut-brain interaction. This is a paper that Dr. Brian Lacey and Dr. David Kangemi from the Mayo Clinic recently wrote, and it is a discussion about the role of psychological interventions in general in disorders of brain-gut interaction, but also in particular the role of virtual reality. And I'm going to talk today about some examples. This is a picture of a patient at my hospital, Cedars-Sinai Medical Center in Los Angeles. We have the largest hospital in the Western United States. We have a large inpatient population, about 1,000 beds. And this is a patient who's experiencing severe pain. Now, at this moment, he is in a helicopter flying over the snow in Iceland. And you can see he has an emotional response. Emotions matter. What do I mean by that? If you think about your strongest memories in your life, the positive memories and the negative memories, they're all tied to a strong emotion. That's how you learn things. That's how you remember things. That's why when I give this talk, I show a picture on the screen rather than bullet points so that you can see what he's experiencing. You can feel what he's experiencing. Emotions matter, and virtual reality creates emotional experiences that are powerful and that affect the human body. We have now seen that it can change cortisol levels, it can change body temperature, it can change white blood cell count within 15 minutes in a recent paper. Okay. It can change the heart rate and the heart rate variability, the pupil diameter. We can modify the autonomic nervous system quickly using this technology, and I'm going to show you in a moment how that happens. This is a picture of me and Dr. Omer Liran. He's a psychiatrist. He helps us administer virtual reality in our hospital. We have a consult service. We get called to deliver virtual reality. Here we are using biosensors in the headset, measuring pupil diameter, heart rate variability, and eye tracking. And it's giving us data on autonomic function. And then artificial intelligence is changing the visualization, as I'll show you, to keep up with the patient's biosensor data. This picture points out something else, though. It's the idea of escape, of getting out of your body, out of your mind, at a moment when you are in pain, or anxious, or frustrated, or upset, to get out of that moment. And in this picture, you can see in the foreground there are cables. It's almost like she's in a jail cell, in a prison. Not just the hospital prison, but the prison of your mind itself. Escape really matters. That's the second principle that I want to describe. This is an example of one of the visualizations, a little bit loud, we can turn it down, that we use in our hospital. This is a visualization where you move into different fantastical worlds when people are sitting in the hospital room. You can hear the music, you can see the pictures. This is a patient who's allowed us to show his image. All of these patients have given us permission, and he has inflammatory bowel disease. He comes to the hospital a lot. When he comes to the hospital, he goes into outer space. He says it gives him a sense of awe. Now, no estoy seguro qué es la palabra por awe en español. Es como asombro? Is that the word? Okay, como asombro. It's a sense of awe. It's como, ¿cómo se dice? La sensación de ser parte de algo más grande que uno mismo, right? Like you're part of something greater than yourself. Part of algo como magnífico y cosmológico. That's what it feels like when he goes into outer space. And he says that it gives him goosebumps. He says it gives him this feeling on his body. And in fact, there's a study called Are You Awed Yet? How Virtual Reality Gives Us Goosebumps. I'm not sure you say goosebumps in Spanish, but you could see it there. This is a study, ¿cómo? Piel de qué? Gallina. Gallina? Chicken. Chicken, oh, okay. Me entiende. So this is a study from Simon Fraser University in Canada, where they took people, put them in virtual reality. They flew them over Vancouver, over the Canadian Rockies, and blasted them up into outer space. And at all the same time, they have a camera on the forearm called the Goose Cam, and it is looking for goosebumps. And they find this dose-response relationship between the amount of virtual reality and the onset of the goosebumps, and differences by biological sex also. Very interesting study looking at the physiologic and psychological response to these experiences. So these are the three concepts: emotion, escape, y asombro, okay, and awe. And I now want to show you how this works. This is two computers, and I have a patient in this room. This patient has irritable bowel syndrome. You can't see her, but this story was actually on Univision last year. So the patient is Mexican, I believe, and she has had severe abdominal pain. Her son died in a car accident 6 months before this video was taken, and nothing has been helping her pain. Somebody tried to give her opioids, which is not going to help her pain. That's not going to help. She's tried antibiotics. She's tried many different therapies. We decided to try virtual reality. So what you're going to see here, you can see on the left, this is the biosensor data. Here she's on a beach. This is a mandala expanding and contracting with her breathing. You can see the breaths going in and out. But when she first came in, she had severe pain and anxiety. But right here, you can see what happened when the virtual reality began. We saw a collapse in her autonomic function. This is an integrated measurement that is called cognitive load, accounting for pupil diameter, heart rate variability. We thought she was sleeping because she was quiet. And we said, "Are you okay?" And she started to cry. She said she was in heaven with her son. We then said, "Do you want to stop?" And she said no. Right about here, this is at 12 minutes, she said that she was in heaven with God. Now, there was a reporter, a journalist from the New York Times who was in this room, and they wrote an article about this video, so you can check that out. So afterwards, we said, "How are you?" And she was crying, and she said, I'm not sure how to say this. She said she was floating, flotando, right? Sentía como si estuviera flotando, right? And como si su sistema nerviosa la hubiera liberado, like she had been released from her nervous system, like she felt like she was floating. She said, "I have no pain right now." Now, this is not how it always works. It doesn't always work that way, but when it works, I usually show them this video. This is a picture from the University of California, San Francisco, called the glass brain, and I show this to them. And I say, "I want you to look at this, because your brain is not like a ball of clay in your head. It is an organ like every other organ in your body. It changes. You just changed your brain." And this is showing the dynamic networks within the brain, the default mode network, for example, and others, the activity within the brain. And I will say to them that even when we are in physical distress, we can still modify how our brain perceives our body. We can change the way we perceive our body, even if we can't fix the problem, even if we can't do a surgery to remove the problem, or do a procedure to get the problem out, or we can't do an x-ray of the problem, can't run a blood test for the problem. You can always change the way your brain is experiencing your body. We know this all the way up to the moment of death. People have had out-of-body experiences they describe at the moment of passing. This is powerful. Our psychologists know this. We need to know this too. And virtual reality is simply a way to help tap into that realization. And so people will say that they don't have pain, and I will say to them, it's like you have a supernatural power. Super means above. It means you've found a level of consciousness above your normal level of consciousness, like a Buddhist monk is able to achieve consciousness after 30,000 hours of practice. In virtual reality, we can entrain the brain quickly. It's natural because we didn't use a medication. Now, I'll also say we did not cure your IBS. All we have done is given you an insight about the way your brain and body communicate. Now we need to work together for the next 8 weeks to figure out how to make this stick. Now, we know what happens in the brain because there's been research going back to 2007 from the University of Washington using functional MRI scans with virtual reality in people experiencing pain. And you can see here on the left is a patient experiencing pain. You can see the pain signals in the sensory cortex right there. But also look in the middle, in the limbic system, in the insular cortex. Pain is not just physical. Pain is psychological. We know this. Sometimes it's the psychological pain that's worse than the physical pain for many of our patients. Opioids do not help with psychological pain very well. Maybe they help with physical pain a bit, sometimes. Sometimes it makes it worse. But with virtual reality, consistently we see a reduction in those pain signals on functional MRI scanning. These are 2 randomized controlled trials, not in GI. I will talk about GI in my last few minutes. On the left, these are patients with severe burn injuries going through bandage changes at the University of Washington. On the right, women going through childbirth at the University of Michigan. In both cases, randomized between virtual reality and no virtual reality. What you'll notice is the outcomes are very similar. Not only is there the cognitive aspect of pain, which is how much time did I spend thinking about it, but also the sensory, how bad was the pain, and the affective component, the unpleasantness of the pain. In all three cases in both studies, virtual reality is the black bar on the left, the white bar on the right. There are statistically significant and largely clinically relevant improvements. An interesting outcome is fun. I've not seen a GI study looking at fun as a validated outcome measure, but hey, why not? This is a study where during a bandage change for a burn injury, they were having more fun. Now, in our field in gastroenterology, there's been research that goes back quite a while. This is a study, I'm sorry, it seems to have been lost at the bottom. I think this is 2004, 2007, I forget, but this is from Japan. And it's a randomized controlled trial of an old system, very old system, using virtual reality for colonoscopy. And so what you can see here is this patient is getting a colonoscopy. They have their hand on a patient-controlled analgesia button to deliver propofol when they need it. They're doing it themselves. In this study, they were randomized into 3 arms. One was purely visual distraction, one was visual plus audio, and one was neither. In all cases, they had the button. Now, if you look at group 2 in the middle, that's where there's the combination therapy. They reported the lowest dose of propofol, the lowest perceived pain score, highest satisfaction, and the highest willingness to repeat the procedure in the future with the same mode of sedation. More recently, this study has been repeated, and in this example, the researchers also looked at a biosensor looking at skin conductance and were able to demonstrate reduced skin conductance. I will say that there has been one study I don't have here for upper endoscopy that did not show benefits. And that study, it's unclear to me exactly why the benefits were not shown, but I will say that it's very difficult to do an upper endoscopy with a headset on. The whole purpose of the headset is to be able to move your head around and be immersed in the world. And I think that's going to be challenging with an upper endoscopy. But for colonoscopy, we've had success because people can move their head and look around a little bit. We're on the other side of the body. This is a study, again, from the Mayo Clinic. I was a part of this with Dr. Brian Lacey, David Kenjemi. This is a small study using virtual reality as a pilot study for functional dyspepsia, showing early evidence of benefit, although a small study. There's now a larger study undergoing at the Mayo Clinic right now with a new software program. I'll show you more about that in a moment. That is being evaluated. Now, this is our mobile cart. This is not a endoscopy mobile cart. This is a virtual reality mobile cart. We bring this around the hospital. That's Dr. Liran, our psychiatrist, and he has a ultraviolet light box to clean the headsets, to clean them between patients, and we have a technician who helps us in the hospital use this software. It's called the Virtual Medicine Program. I want to show you 2 patients now using virtual reality for the first time. Turn the sound down a bit. The music is what they're hearing. Turn it down a bit. Yeah, we see that a lot actually. A lot of people that get emotional. Right.
I don't even have the words to explain it. It's beautiful. It's touching that you guys are doing something that's so great. Being in here and being able to just escape what's going on. Yeah, just when I'm like, ooh, I could just sit here, especially on the lake. I'm like, shoot, I can pretend like I got some barbecue. That's all I need, and just chill there all day.
So you can see how her body language changed. She talked about escaping. So this is a paper we published a couple years ago in the American Journal of Gastroenterology on initial development of a therapeutic approach for irritable bowel syndrome. Rather than always bringing patients to the clinic, with virtual reality we can bring the clinic to the patient. And this is an 8-week treatment program where they unlock different rooms progressively. This uses a combination of virtual reality and artificial intelligence over 8 weeks to unlock a series of different rooms that include gut-directed mindful meditations, that include various forms of gut-directed cognitive behavioral therapy. And so we're developing it and validating it right now. This is an example of what it looks like when a patient pretends to be in a bathroom. And they put on a virtual reality headset. This is somebody who's very stressed and anxious about being in public bathrooms. And so they look around and they're in the bathroom. And there is some sound, you may not be able to hear it, I guess, but they're able to do cognitive behavioral therapy, and there's somebody talking right now to the person to help them prepare for what they're going to do next time they're in a hurry and they have to go to the bathroom and there's people waiting for them and they need to get to a meeting, and they can do the cognitive behavioral therapy right there in the bathroom and practice over and over again.
Welcome back to the theater of the mind.
Okay. I'm going to end with this. This is our latest software. This is using the Apple Vision Pro. This is what it looks like. This is a patient sitting at home on the couch talking to a robot. That is a robot. It looks like a robot. It looks like something out of a Disney movie. It's using 6 different forms of artificial intelligence in a private environment to provide mental health support using natural language processing and conversational interactive. She's changing the environment to a forest and butterflies at this moment. Depending upon what the patient is talking about, she will change the environment so it's metaphorically appropriate for that moment. She also will have, she has 150 different facial expressions. If at any point the patient expresses suicidal ideation, she is going to contact the psychiatrist within 1 second by text message and by email. And so this is undergoing testing right now. It's been very interesting and exciting to use this in our hospital and to see how our patients interact with what would seem to be a very bizarre experience, but actually our patients seem to like it. This is what she looks like. We had a paper that came out recently about this, and she actually will write a note. That note will be written up and put in the chart. She writes the note. Now, we still need human beings to look at that note, and we still need human beings to look other human beings in the eye. But this is allowing us to be more efficient with our psychology inpatient service right now. So I'm going to end there because I'm out of time. These are just some more pictures of Dr. Liron working with our patients. If virtual reality is a therapy, we need a VR pharmacy. We now have a journal. It's the Journal of Medical Extended Reality. This is a new field of medicine that the Food and Drug Administration, the FDA, now recognizes. It's called MXR, Medical Extended Reality. We now have the American Medical Extended Reality Association that came out of Harvard and the International Virtual Reality Healthcare Association. If you're interested in this, we have a website, virtualmedicine.org, where you can learn more. We also put on a conference every year in Los Angeles in March. This year it's March 27th, March 28th. We've had a lot of folks from Central America and South America and all around the world who come. It's a lot of fun. You can see all the technologies and learn how different doctors around the world are using these technologies. I wrote this book, and that's enough on that. And so I'll finish here. Since I'm coming from Hollywood, I'm going to end with a scroll of all the different people who have helped to do this research. So sorry I went over a few minutes, but thank you very, very much again. Gracias otra vez por la oportunidad de estar aquí con ustedes, and I hope that was helpful.